Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. We're here today with Mr. Jimmy Hall of Fayetteville, North Carolina. And Mr. Hall came to see us originally this year, January 16th, 2012. And Mr. Hall, what did you come to the Goldberg Clinic about?
I came because I had a bad problem with my sugar levels being higher than normal and just feeling bad all the time.
And in fact, you had been medically diagnosed as having
Type 2 diabetes.
Type 2 diabetes.
That's correct.
Okay. And what was the what kind of treatment were they giving you for your Type 2 diabetes?
They had me on Actose medication and other medications, of course, for the side effects from the Actose.
So you were on medications for the diabetes, and then you were taking other medications for the side effects of the medications they were giving you.
That's correct.
Okay. And what were the symptoms that you had from your diabetes?
Just anxiety, tiredness, dragginess. My mind's real foggy all the time. Blurred vision.
You had blurred vision. You were fatigued. You were foggy-headed.
Yes.
Okay. And what did your doctors tell you? That with all these symptoms you were having, they're giving you drugs and it wasn't working? And what did they tell you?
They just told me I would need to just stay on them and maybe add another one later. And that's what they done. They just kept taking one away, giving another, or leaving me on the original one and adding to it.
And when you were on these drugs, were they making you feel better? Did you feel healthy on the medications they were giving you?
No, I felt worse.
Okay.
I felt like I was in a daze all the time.
Now you're a busy man. You own a heating and air conditioning company, a successful firm in Fayetteville, North Carolina. What's the name of your company?
Jimmy Hall, heating, air conditioning, and electrical contractor.
Yes, if you need any heating and air conditioning electrical contracting, and you're anywhere in the Fayetteville, North Carolina area, this is the man to go see. How do you like that? We have you a little plug.
I like that.
Yeah. And Jimmy, how did you feel about your situation? That you had this diabetes. Was it being well controlled? Were your blood sugars normal? Was your urine normal in terms of glucose?
No, to me nothing was normal, nothing was getting better, because every time I check my sugar or go and get a blood test, it always come back pretty much in the same line, even though I was taking all the medication.
Yeah, and the same line was what?
250 to 225, and at times, you know, it even got up to 400.
So your blood sugar was 250 on up, all the way up to 400.
Yeah.
Which is way, way, way higher than it should be.
That's right, and that's been the last 10 years.
That's been for 10 years now.
10 years.
So you've been under medical supervision 10 years. It's not getting any better.
Right.
It's getting worse. You're not feeling well. You're foggy-headed. You're fatigued. Did you have depression at all with this sometimes?
At times, yes.
Despite the fact that you're a very positive type person, I know that just from being around you some. And you were, what's that, Miss Hall? And he was irritable. Miss Hall's, his lovely wife is sitting over here on the sidelines here saying he was also irritable.
Very irritable.
Very irritable. All right, we got you in here and we did a workup on you, a physical exam. We did some functional lab studies on you. We got you on a program. What were the results of the changes that we made and that you instituted yourself?
What were the results of it?
Yeah.
Well,
what kind of changes have you had happen to you since you've started on the program here at the Goldberg Clinic?
Well, I usually check my blood sugar 2 to 3 times a day. The second day after I was on your program, my sugar went all the way down to 139. And then I just started feeling better, started feeling more energetic. The blurred vision just left within the first week.
That's a nice little thing when your vision is blurred and all of a sudden it becomes clear, isn't it?
Just cleared up like a bell.
Yeah.
That's correct.
Right. 10 years of medical care, licensed medical supervision, drugs, and just about 48 hours afterwards you start feeling better. And we have checked your blood sugars, we have checked your urinalysis, everything is normal now. What drugs are you taking currently? What drugs?
I'm drugs-wise none.
You're not on any drugs at all. Have you lost some weight?
Yeah, I've lost 12 pounds.
You lost 12 pounds. You really weren't that heavy to begin with.
No, I was
Yeah.
not.
And how's your mental attitude now as compared to before?
Very positive and real quick and witty and just feel better.
Your wife says you're
A happy person.
a happier person now. Okay. All right, so now you got a lovely wife, you got a good business, which is called, what's the name of your company again?
Jimmy Hall Heating, Air Conditioning, and
Jimmy
Electrical
Hall Heating and
Contract.
Air Conditioning, yeah.
Yeah. And electrical contract.
And electric, they do electrical work too, by the
That's
way.
right.
Yes, that's right. All right, well, thank you for that description of your case. We're so happy that, and I have to say this, It's a shame that people are suffering like this. We didn't do anything miraculous. This was all natural care. It was based on the causes of Mr. Hall's metabolic disturbance. We did not treat his diabetes. We just returned function to normal. And when function goes back to normal, people start to function normally. And when they function normally, organs, glands, nervous system, everything starts to function normal, then the body gets healthy. And when people are healthy, they're happier, they're going to live longer, and importantly, Mr. Hall doesn't have to be so concerned now about all the repercussions of diabetes, which include heart disease, stroke, arthritis, blindness, problems with circulation. All those risk factors have just now been dramatically reduced, so he can live a much healthier and happier life.
Yeah, and one other thing, when you said that circulation, that reminded me, the month before I came here, I'd wake up in the middle of the night, my feet would be freezing, and I'd have to get up and put socks on. And now, I've not had that problem at all. My feet have not been cold anymore, and I know it was from circulation, because, I mean, the feet just stay froze, solid froze all the time.
They were frozen all the time before. Yeah. So diabetes is a metabolic condition, and there's just really no reason why people need to suffer like this. Particularly if Mr. Hall is fortunate, he had this condition for 10 years, we're still able to reverse it very, very quickly. It's important for anybody that has blood sugar disturbances or wants to avoid them, that they find out the right things to do. So now once again, Mr. Hall has taken his health care and made it into self-care, because now he knows what to do in order to remain healthy for both the present and the future. Thanks, Jimmy.
You're very welcome.
That's Fayetteville,
North Carolina.
North Carolina.